Hi, David McIntosh, ear, nose and throat specialist. Today I wanted to introduce you to a concept that you may not be completely familiar with, but it will make sense once I've explained it. Say for example you break your leg. You go to hospital, doctors fix you up, nurses help out, but then it's the job of the physiotherapist to get things going again. Whilst that leg's been healing, you haven't been moving around very much, the muscles around the limbs start to waste away a bit. Physiotherapists will get you into some exercises and work on a program to get things sorted. What you may be interested to learn is that this also applies to sleep apnea, and it seems to be in children and adults alike. It's got a special name. We call it myofunctional therapy. Myo means muscle, and function is all about it doing what it needs to do. We know that there are a subset of children that respond very well to surgery and medications for their sleep apnea. And, as I mentioned in another video, jaw, teeth realignment through a dentist or an orthodontist. But there's a group of children that are quite interesting in that the function of their muscles around their face and their jaw and their throat aren't quite right. And these dysfunctions seem to play a role with regards to the outcomes of treatments that are pretty conventional, not necessarily being to their full benefit or perhaps for longevity. Myofunctional therapy is not a new concept to the world, but it's a new concept to those that speak English. It's been around Brazil for a long time. A lot of it's in Portuguese though. There are practitioners now offering myofunctional therapy, and it's important to realise that this is an adjunct or a supplement to the other treatments. Just like if you broke your leg, you wouldn't see the physiotherapist to get the broken leg fixed. The physiotherapist helps rehabilitate things. And that's the same for a myofunctional therapist. And they seem to have a role when it comes to airway breathing problems, such as mouth breathing that persists once things have been unblocked so that the nose should and could work better. There may be a role for them in things such as tongue ties once they're released. But again, time will tell as to how this all comes to play. What's really interesting is that it even seems to help adults. And my analogy, it's a bit like sending the throat to the gym. If we can build up the muscles around the throat that otherwise are a bit loose or a bit weak, collapsing in, then it makes sense that with this therapy, strengthening will hold the throat open. And that seems to translate into reality. There'll be a lot more to come over time with regards to research on this matter. But in the meantime, there is a small number of ear, nose and throat specialists that know about myofunctional therapy, but there's an even bigger group of doctors that know about this, and that's the dentists. They've been using this with their orthodontic treatment, again with some interesting results. Anyway, just want to highlight the fact that myofunctional therapy is an option that has a role to play, and we're still to work out exactly how it fits into the plan, but the important thing about the plan is having a team. We get a team of people involved that know how to manage these problems. They can all point us in the right direction. Have a good day.